One of Indiana's largest state agencies is making changes following a WRTV investigation. Our Kara Kenny uncovered a gap in how the state oversees mental health facilities and protects our most vulnerable. She joins us now with the changes underway and why some say even more needs to be done.
The Indiana Family and Social Services Administration is making big changes, including that you can now file a complaint online about a mental health facility. Previously, you had to call a hotline with your concerns.
For 9 months, we've been asking to speak with someone on camera at the Indiana Family Social Services Administration about oversight of mental health facilities. Patients like Melissa Toms told us the state system for filing a complaint is confusing.
I think it's ridiculous that has to be so hidden or so hard to do.
On August 6th, we caught up with FSSA's new director of the Division of Mental Health and Addiction, Sarah Sailors.
Why did FSSA create this online portal system?
Sailors told us it's been in the works for years now.
It just lined up in timing wise with your question and our technology that was ready to go.
Why do you think that's important?
I think that we need to meet people where they're at, right? Statute requires us to have a hotline, but not all people are comfortable making those calls and talking to another person.
WRTV Investigates found Indiana had no mental health ombudsman for 3 years, from June 2022 to June 2025, even though the law requires it. An ombudsman can investigate and resolve patient complaints and make sure your rights are protected. Following our reporting, FSSA signed a contract with Intacare to handle ombudsman duties. It took effect July 1st.
I think it gives people somebody to advocate for them.
What, if anything, will FSSA be doing to let people know that there are these options available?
Having an opportunity to discuss this with you, hopefully, you sharing that will help enlighten the community that this exists.
The new ombudsman will focus on unlicensed mental health facilities and issue recommendations. Complaints about the state's 37 licensed providers will be forwarded to FSSA, which can take action against their license.
What's the bottom line? These complaints will be investigated by someone.
Correct. Either the ombudsman or the division themselves.
Patients say there's work left to do. You still can't look up inspection reports online.
Would something like that be a possibility for mental health institutions?
I think that we're open to, working with our legal team to figure out what can we share and what can help the community have the information that they need in real time.
Is FSSA being transparent?
We have committed since 2023 to really be more transparent. I think it takes time, right? And that I can see why people are frustrated and that they might think that we're not moving quickly.
FSSA wants you to utilize the new online portal system and the ombudsman. They say that input helps them make better decisions about mental health care in our state. Kara Kenny, WRTV.
The 2-year contract will cost the state $80,000 and runs through 2027. Intacare released a statement saying, as the mental health ombudsman, our mission is to advocate on behalf of consumers, assist in resolving concerns, and provide recommendations to improve the behavioral health system. We are honored to serve in this role and look forward to working collaboratively with individuals, families, and providers to ensure fair, respectful, and responsive mental health services throughout the state. You can read that full statement on our website, WRTV.com.